Hi, and thank you for joining us for this conversation. My name is Christine of Supermamas, where we are passionate about empowering you to be the best woman, the best mom that you can be. Thank you so much for everybody who subscribed so far. And if you haven't subscribed to our channel, please hit the subscribe button and we'll be happy to keep empowering you so you can be amazing in this motherhood journey. UTIs, that's our subject for today. Urinary tract infections. I know a lot of women struggle with them, and today we are joined by the awesome Dr. Kakuti to empower us on matters UTI, so you never have to struggle again, hopefully.
Thank you, Christine. Thank you for inviting me again. I'm so happy. It's always amazing to see you.
No, lovely to have you.
Looking really good.
Thank you, thank you.
Thank God.
It's it's my weakness, right?
You know, I mean, you're just fearfully and wonderfully made.
Thank you.
Thank you for this opportunity. It's so much fun hanging out with you.
Yeah. Same here.
So today we're going to discuss urinary tract infections.
You know, when I think about UTIs, how prevalent they are, do we talk about them amongst our women's circles?
So a woman will probably tell a friend, hey, I'm feeling something. What are you feeling? But then she doesn't want to say what the feeling is.
Why?
We still get embarrassed about talking about anything around our private parts. And we shouldn't, you know, we should be our sister's keeper, because if you had a UTI and you got treated for it, then I tell them having these symptoms, you know, I should be able to say, you know, Christine said she had this. Even if she didn't, I should feel free to ask you that you can direct me, I can get help. Because one, there's unscrupulous abuse of antibiotics in Kenya.
And on the matter of antibiotics, I think it's just a global thing that we abuse antibiotics.
Absolutely.
And it's something we need to talk about one day.
Yes. So if I can walk into a chemist and I say, I'm having these symptoms, they will not test you. They'll just give you an antibiotic. For them, it is business. It is important when you have a symptom or any illness, go and see a doctor, or even if you're in the rural areas, then you don't get a doctor, but you can have a clinical officer or a nurse. Let her test, let them confirm you have a UTI. It could be something else.
Do you know, most of us assume we have UTIs because, the other time, say probably you are eating or this other symptom.
Exactly.
And then at the chemist, you get whatever you need to get.
And the chemist will freely give you what's the problem you have. The guy is writing the prescription before he's even asked you more symptoms. So what happens is you build resistance against these antibiotics over time because you're abusing them. And then maybe you're treating the wrong bacteria. Remember, not only one bacteria causes UTI. There are different types.
Speaking of which, let's go back to where we should have started. What's the definition of a UTI? I think I've said it in full, but what causes UTIs?
Yeah. So let's start with first. Urinary tract infection actually is an infection in any part of the urinary system. So that's the kidneys, the ureters, and your kidney is actually interesting, located here. So when they do a kidney transplant, you find someone with a scar over here. I love anatomy. When you studied medicine, you're like, the kidneys are here.
How come the diagram show them at the front?
No, they're actually at the back here. They're at the back here.
All this years on this planet, I've never known.
It's okay. Everybody's got their, what they're going to do. So the kidneys are back here. So if you have a kidney infection, that's pyelonephritis. So UTI is an array of different types of urinary tract infection. Because urinary tract is the kidney, the ureter, now where the urine is formed in the kidney, comes down the ureter, enters the bladder. If you have infection of the bladder, that's called cystitis. And then now you have the urethra, the blood, where the urine comes from the bladder. So any infection along that tract from the kidney is a urinary tract infection, because that's a urinary, we call it the urinary tract system. Yes.
That makes sense.
Yes. Okay. So they're different. So you need to find out where the infection is coming from. Now the infections will always depend on where it is starting. So the symptoms will vary. All right. So the number one symptom most patients will tell you is, I'm having a burning sensation when I'm passing urine. Yes. Okay. And it is painful. So you actually start passing urine, next thing you're like, what?
It's painful.
You feel like someone put a matchstick there, and they'll actually cut off the urine. It is painful. So you ask them, is the pain when you start passing urine, in the middle of when you're passing, or at the end?
What's the difference?
So it will tell us where the UTI is coming from.
Really?
Direct us, yes. Is it from the bladder? Is it from the urethra? It will tell us what type of infection you're having. Then, when we know the symptoms, the other thing which is to clarify is the severity. Now, if you have a fever, if you have pain in any other part, so you're having burning micturition is passing urine. So if you're having pain passing urine, coupled by a fever, coupled by cloudy urine should be clear. If you drink water well, it should be clear, almost the same color as your toilet, whatever. And then maybe the yellow, clear yellow if you're not drinking enough water, but it shouldn't be cloudy.
So cloudy means what? Whitish?
Cloudy, yes, whitish, yellowish, but if I put it in a glass, I can't see through it. Normal urine, I should put my glass and
cloudy. That makes sense.
Yes,
that
cloudy
makes sense. Okay.
or turbid.
Okay.
Then the other thing is blood. So certain things that point towards the severity are pain and blood. Blood tells us that there's something which is even happening worse.
Right.
And some patients, even pyelonephritis, the one for the kidneys, we have to admit you. That one requires IV antibiotics. So we normally classify the type of urinary tract infection you have. So you can't walk into a chemist and be given an antibiotic for 3 days when you have pyelonephritis.
No.
You will come back with severe infection. And remember, the more severe it is, untreated and unchecked, can actually cause permanent damage to your kidneys.
Recommendation number 1, if somebody suspects they have a UTI, it's better to go to the doctor. Let's stop going over the counter and getting antibiotics.
Yes. And you're going to be, remember again, not one type of bacteria causes UTI, they're different types.
Okay.
So when we do a test, the test will tell me that there's a urinary tract infection or there's pus cells in the urine. We look for WBCs, white blood cells in the urine, or we look for pus cells. Then we quantify. Now that will tell me the severity. Now I can start you on empirical antibiotics as I wait for another test where we do called culture and sensitivity. So culture and sensitivity is where I'm saying, you have a UTI, we give, now it's telling me the type of bacteria, the name of the bacteria. So if the bacteria is called Christine Cassina, it will tell me.
Why did you have to use my name?
I don't know.
But anyway.
Yeah, because different bacteria have different names, like human beings. It's amazing. So then they'll say, this bacteria, these are the antibiotics to give, the appropriate antibiotics to give. So you're not playing Russian roulette with the patient.
No, it shouldn't be
so
like
wrong.
that.
Because what happens is she'll come back again with recurrent UTI.
That would be terrible.
And the more you keep giving antibiotics, that she develops what's called resistance. Resistance means you have a UTI, I give you an antibiotic, the bacteria is like, I'm so used to you. I'm so used to you. So it's not going to go.
Yeah.
Then I'm forced to use something more expensive, admit you to hospital and make it even worse.
So it's better for of course the doctor to get the exact cause of your UTI.
Exactly.
Speaking of which, you've mentioned recurrent UTIs. What would make a patient or a woman have, even a guy, have recurrent UTIs?
Yes. So one, improper treatment. As we've said, over the counter, I have a burning sensation, I pass urine, and I go and they give me an antibiotic.
Yeah,
it comes back again. It comes back again.
Okay.
The other common people who get UTIs are people who anything that affects your immune system. So pregnancy is one. Pregnancy, when you're pregnant,
a thing, by the way.
When you're pregnant, people have frequent UTIs. Any situation or any condition in your body that lowers your immune system. So if you're HIV, if you have diabetic, if you have been unscrupulous using antibiotics as well,
it lowers your immunity.
Yes, it lowers your immunity. So any condition that lowers your immunity, but specifically for women, pregnancy. So you get
that, by the way,
because your immune system takes a little bit of a dip. Yes. So again, you need to know how to manage them. You don't just go and throw anything at them. Don't walk. And especially remember pregnancy. There are some antibiotics that can give you, Christine, when you have a UTI and you're not pregnant, but they will be what we call teratogenic to the baby, harmful.
This is when you should never, when you're pregnant, go over the counter.
Do not. Because first of all, you don't even know you're pregnant, or you go to a pharmacy whereby the person doesn't know you're pregnant. You don't even tell them you're pregnant, or even if they know you're pregnant, they don't have the knowledge to know. There are certain groups of antibiotics I would give her if she's pregnant, if she's not pregnant, but now she's pregnant, I can't give her. So teratogenic means they can harm the baby.
Understood.
Baby is born with the physical defect, on an internal defect.
God forbid, man.
God forbid. So you want to make sure that you are going to somebody who is well schooled, and even some nurses. Don't even feel bad about going to, a clinic and you find a nurse. They know what to do. But if you find someone giving you medication just like that, not testing you, please run away.
Okay.
Get tested.
All right. How do you treat UTIs? How do you treat them? So you talked about antibiotics, of course.
Yes. So one, it will depend on the severity. So once I'm sure, when the report tells me, we've done a culture and sensitivity, it tells me the bacteria is E. coli ABCD. Then it will tell me these are the antibiotics effective against. And there's some written RRR, that means they won't work. The ones in SSS means they will work. So we know how to read the reports they give us. So I will give you, I will not start with the most expensive, the Ileaju. I'll start with the lowest sensitivity. In case. And then most likely what I'll do is advise you on taking a diet that alkalizes your body. Now, when you have a UTI, your urine becomes acidic. The system is acidic.
So what do I need to eat?
You need to keep your body up. Let me tell you, shock on you. Lemon juice, orange juice, watermelon. I
was waiting for you to say yogurt, because that's the other thing with UTIs. People believe that if I double my intake of yogurt, then...
So yogurt has a more management of candidiasis is the one which is more associated with yogurt.
Okay.
So for urine, you want to take it back to an alkaline level. Actually, for healthy living for your body, should actually be in an alkaline state. I was shocked that when you eat oranges, when you eat citrus fruit, they are acidic, but they're converted to alkaline. Watermelons are great for keeping your body in an acidic state. UTIs, cranberry juice. A lot of research is so some research is very skewed. If you look at, let us study women with UTI and give them cranberry juice. I still believe in giving patients holistic treatment. And I'll tell you, here's your antibiotic, but then go and do ABCD. Make your cranberry juice, throw in a lemon, an orange, and then add maybe something like chamomile tea, anything that will make your body alkaline.
I have a new respect for people who wake up in the morning and have a glass of water and lemon.
Yes.
Now I know why.
Yes.
That could help.
That hot water
will
lemon,
help.
yes.
That would help.
Yes, and open your digestive system and all that. So these things that were taught, that our grandmothers knew about, home remedies, some of them actually still work.
Speaking of which,
yeah.
as we're winding up the conversation, home remedies for UTI. I know you've mentioned
Cranberry juice,
orange juice,
orange, any
citric. Anything in the citric group,
yes,
you're good.
And then there are also other what we call urine alkanizers. So they're medication, but they're urine alkanizers. We'll give them to you.
Okay.
The other thing I'll tell you is take plenty, or just down water.
Really?
Water can even improve your symptoms in hours.
What, flushes your system?
Hours, just flushes your system. Yes.
Okay.
You're going to pee a lot, but it's worth it. The symptoms actually start getting better. The burning reduces, and then if you do have a fever, so if it is a severe form of UTI, of course we will admit you and may give you antibiotics for 48 hours, admit you, because you want to start killing that bug very quickly.
Okay.
If it's a severe form, because you don't want to damage the kidneys, then 48 hours we send you home on antibiotics. After 7 days you come back, we review you.
Okay.
Others which are uncomplicated, home remedy, maybe a simple antibiotic like azithromycin 500 milligrams. I'm not saying you go and buy it because I've said it.
Go and see your doctor.
Go and see your doctor. Go and see your doctor. Go and see your doctor. Go and see
Okay.
your doctor. Yes. So there are uncomplicated UTIs that we can tell you know what, take this, but you must get tested. Let me confirm. Allow me to confirm that you have a UTI. So this thing of going to chemists and scoring drugs.
No.
This is not cocaine. No. Please, you need to get.
That was very funny.
Yeah.
That was
This is not cocaine. You just don't score. They will mess you up. They will mess you up eventually.
Daktari, a myth we need to bust. Is it true that more women than men get UTIs?
Absolutely.
And why? If it is true, it's
absolutely true. Yes. So the female urethra, so from the outside, where you have the vulva, the female private part. So how many holes are down there? I ask women, they say there are 2. I'm like, we have 3 holes. So you have the urethra, the vagina, and the anus. The urethra, where now the urine comes from, the distance from the urethra to the bladder where urine is stored before you pass out is only 4 centimeters for women. So here's the thing, any small bug. Other thing about UTIs is they're very common, especially after sex.
Oh.
The women who get UTIs after sex. Yes. So the friction, when you're having intercourse, during that friction can cause some irritation to the urethra. So a small bug will say, hello, tuingie.
But you know, most people will not think like that. I would think that maybe your partner or my partner is sleeping around.
I tell women, please pee after sex. Please, because our urethras are short.
Nobody thinks like that. Like,
yes, you want
honey,
to cuddle.
I gotta pee.
No, I'm not saying to go and take a shower and wash yourself. Just go.
So before cuddling, go pee.
Before that, cuddle. But then again, this thing of we cuddle all night. Me on my space to sleep. So the other thing is pass urine after sex, especially if you eat. Do not allow an empty blood after sex. It's good. It's just important. It's good practice to do that. And then come back and baby, what's up? Then the other thing is for men, they have longer urethras because of the length of the penis. So they have less chances of getting UTIs compared to
because
us guys.
It's longer.
It's a longer urethra. For women, it's only 4 centimeters. The other thing is, remember how we teach our girls to clean ourselves. So when you pass stool, we teach our daughters to do what? Clean from front to back. Don't do this.
So it should be front to back.
Front to back through that tissue. If you're not clean yourself, front to back. If fecal matter comes near, stool comes near the urethra, bacteria from the anus that are normally supposed to be there will enter the urethra and cause UTI. Then you get an E. coli infection. Same thing with the vagina. You get candidiasis. Yes. So it's important to teach you. I tell people, please, I'm OCD about down there, wet wipes. Because if I take past stool in my house, you don't want to find you've got skid marks and you're walking around, because what happens, that stool is going to enter through your part, it's going to rub on your underwear, and then that is going to enter your urethra or whatever. So if you're anywhere, carry wet wipes with you. If you've got if you can hold your stool until you go, because we all want to take are number 2 at
Absolutely,
home.
exactly.
But sometimes you're not at
Yeah.
home. So carry wet wipes to make sure you clean yourself. Because at home I can take, water, put some tissue in it and everything.
Yeah.
So it's important. And I mean, that's why you find some of these infections are very low among the Muslim community, because they clean themselves with water.
Something we could learn.
Exactly.
Daktari, as we're wiping up this conversation, your takeaways from what we've had today, UTIs. For me, number 1, over the counters, no, very important. I didn't even know that there are different types of UTIs. So it's important for us to come and see you when we suspect we have a UTI.
Yes.
Number 2, wipe from front to back.
Wipe from front to back,
And then
don't
if need
repeat
be,
that tissue again.
There you go.
And make sure you wipe yourself until the tissue is clear.
There you go.
It's absolutely clear. Even if you have a vaginal discharge and you're wiping yourself front to back, you'd rather take the discharge to the back, but not to the front. You understand? So even when you're cleaning your baby, girls, that's the other thing. Yeah.
I think that's for me the main takeaways.
So the symptoms, if you're having burning menstruation, frequency, you can't hold your urine, those are the 3 most common symptoms of UTI. If you start seeing blood, fever, backache, or abdominal pain, then we worry about that it's getting more severe. So as you've said again, a reminder, over the counter, please stop going to over the counter. They will give you the medication very fast. Then you're going to come back and then I have to give you a more expensive antibiotic for a longer duration of time. Because there are people who have to treat a UTI because they did not manage it properly for a month.
Keeps recurring.
So I'm giving you antibiotics for a month.
It becomes resistant.
Which is not good. Yes.
There you go.
Yes.
There you go. I don't know if you have any other parting shot, if at all.
Oh my goodness. I think you've said it all for me.
Awesome.
Yes.
So with that, we have to end this conversation with the awesome Dr. Kakuti. Always a pleasure to have you, Dr.
Thank you, Christine.
I wish I was younger when I was having my babies. I think you're just awesome.
Thank
and
you.
I mean it from the bottom of my heart. If any of you wants you to be hooked up, that's the word, hooked up or hooked to?
Linked up with Dr. Kakuti.
If you'd like to visit Dr. Kakuti and have a conversation, if you could be struggling with UTIs and anything gynecological, just hit the comment section, leave me a comment, and I'll make sure I hook you up with the magnificent and awesome Dr. Kakuti.
Thank you, Christine.
Thank you so much.
I really appreciate it. Thank you so much.
And thank you guys. Keep watching. We love your support.